just want to say that, please, when you're here, you don't have to be so upset. We're here for you, okay? We're not trying to be fighting with you. We're trying to help you. So it just feels terrible that we're trying to help you and you're yelling and screaming at everyone.
No,
The behavioral
appreciate.
health is
No,
bad.
I don't. No, appreciate. Doctor, I just want to know the truth. I'm very calm,
Okay, they
very
want you to come
quiet.
and take a test,
Yes, of course
Melissa.
I'm
Please
coming
don't
at 3
scream
o'clock.
at the people.
I'm not screaming at anybody at all. What is this? Stop
Okay,
that,
well,
Well,
okay,
you
please.
were
Okay,
last time,
can
and
we
you were again.
concentrate
But
on
it's
the
okay.
disease, okay? I just had a bad news and I really don't want to justify myself, really. I just got a really bad news. Can you please tell me what is this
What do you mean
lupus
bad
about?
news?
No,
Well,
he
lupus,
said
lupus.
it's an
What is this?
autoimmune disease that
What
attacks
what
your
is
own.
yes? What kind of
Yeah,
body? What's
you
this?
might not have it. That's why they
But
going
for
to
now,
get
it's
Can I talk?
positive. I just would like
Can
to
people keep
know.
quiet? Can I talk?
Yes, please.
Okay, so keep quiet and I'm gonna talk. I told you the ANA is positive. It's called anti-nuclear antibody. It's a screening test. It tested positive. As soon as I got that, I called the lab and I said, can you please run a confirmatory test? The confirmatory test is negative. So I'm telling you right now, you do not have lupus.
You do not have
Okay?
it.
You do not have lupus. But
Okay.
at the back of my mind, I'm thinking the right thing to do is, why is she positive with the screening test? Does she have thyroid disease?
Right.
That's why we're going to have someone draw your blood and see, do you have some thyroid disease? Is there something else happening in the cells? Then we can talk again. As I have said, 3 people in the past 6 months have tested positive for the same situation. And guess what? We didn't find anything.
Okay.
So the conclusion is, it's just false positive.
Right.
So you do not have lupus. We're going to have another conversation next week or once all the lab results are back. So just please come here maybe a little earlier, like 2:30, so that the blood test can be drawn and you could talk to Shannon, the wire, for your visit. But just come a little bit earlier, like 15 minutes earlier or something like that.
Okay, for sure. I'll be
But
there.
again, I want to let you know that please do not, we are here for you, and it really leaves a bad taste in everyone's mouth when you're always upset and you keep on yelling at everyone. Okay? So, but we're not here to be adversarial on you. In fact, the way I
Yelling.
wrote my notes on you is I wrote everything you told me. Patient alleges she was attacked. Patient alleges her head was hit. All of those I wrote for you. Okay, we're here to help you to the best that we can, but we cannot do that if you're always upset at us as though we're trying to fight with you.
Okay.
Yeah. Is it
Please,
possible?
Dr. Lou, I
Dr.
just
Lou,
had a bad news.
is it possible that she could get some of that information about her getting hit in the head and sitting in the hospital?
Yeah, I just have to say that I wrote down that patient reports. I didn't put there that the patient, that I am confirming that, okay?
Oh, okay.
But if you want a medical record to be released, you just have to talk to the front desk and you just have to sign a few things. But I wrote those down per your report because I couldn't confirm that, correct? But I put it there.
All right.
Okay? Because that's a part of our conversation. Again, please just come here 2:45, and Shannon will help you, and the medical assistant will draw your blood, okay? And I'm sorry for all the confusion and miscommunication, okay?
Okay, no problem.
All
Thank
right.
you
Dr.
very
Lou,
much.
thank you
Have a
so
good
much
day.
for the news. Okay, see you.